The concern remains as to the efficiency in tracing all close contacts to those who tested positive. And from the Central Medical Stores in Kotu, Africa's coverage crew moved to the capital city, Banjul, from where we have Ibrahim Abba live on the line to tell us more on the updates. Now, what is the arrangements on the ground today, Ibrahim, after the venue have been moved to the capital city, Banjul?
Thank you very much, Amadou. So, as usual, this morning we were at the Central Medical Store in Kotu to follow the Ministry of Health and Social Welfare as to the daily updates that is being offered to the media to explain the state of affairs and level of progress on the management of cases of coronavirus in the country. So we were
Yes, Ibrahim, they of course are trying to give us the situation on the ground. As you of course know, of course there are daily briefings to the media on the situation of the coronavirus, and the venue has been moved from the Central Medical Stores in Kotu to the capital city. And Ibrahim Ba is part of the Africa's crew on the ground to give us live updates on the of course from the health authorities or officials, and he was just trying to explain on the arrangement on the ground after the venue has been changed today. And of course, if you have been with us over the past couple of days, starting from Monday to yesterday, it was happening of course at the Kotu Central Medical Stores, but of course due to maybe one reason or the other, it has been moved to the capital in Banjul. In a moment we'll go back to Ibrahim again to of course hear from him how soon we are going to hear today's updates and others as well. So remember again, so far we have just only 3 confirmed cases in the Gambia. I think Ibrahima is back on the line. Ibrahima, if you can hear me now, you were just trying to explain on the ground. Okay, it looks like we still have to wait a bit to get Ibrahima back on the line. As I was just trying to explain that Gambia have only 3 cases confirmed so far, and of course one of the patients of course passed away on Sunday, and as we speak we have 2 patients that have been taken care of by the health of authorities or the medical personnel. Of course one is at the MRC Medical Center, the other one is in the Upper River region in the Basse. Currently as we understand, by the way, so we will of course be going to hear today also from yesterday to now or to date what has the recent development, whether there is any other case or whether the scenario still remain the same. We will of course in a moment going to hear from the authorities or from the emergency response team on the ground as we have been hearing from them over the past couple of days. So it's all about the pandemic, it's all about COVID-19. We have of course many people right now, some good number of them who are still under quarantine, and of course others have been traced, and of course others are negative results have shown they are free to go about their businesses, and of course we want to see more of that. But the impact of the virus globally continue to be to wide, and it's just killing people, and many people, thousands of people are also affected. And of course according to statistics or the WHO, we have over 300,000 people globally that have been affected by the COVID-19 pandemic, which is a global concern, which is really a big deal for the world is confronting right now. And again, as I was saying, we're just bringing you this live update from the from the ground, of course, where the ministry, as the health ministry, will update Gambians as at how the situation is currently is in the Gambia. Okay, we can go back to Banjul, the capital city, where today's press or press conference is taking or update would take place. Ibrahima, good to have you back, and you were just trying to explain the situation on the ground, and you can just pick it up from where you left it.
Yeah, so we from the medical store in Kotu, we were informed that the venue has changed, and now the press conference to update the media and the public as to the level of preparedness for the country and the management of cases will now take place at the capital city, Banjul. That's where we are right now at the Ministry of Health and Social Welfare, where the setup is being done for our technical team already.
Exactly. Yeah, but why is the venue for the daily press conference taken to the capital city? Did you know?
As you know, since weekend, the daily press releases or press conferences have been taking place at Kotu Medical Store, and it has been presided by the Director of Health Promotion and Education, Mr. Njai, who would face the media together with the response team chairperson and other communication officers on the ground. So, like yesterday, there was a sort of indication that the minister was supposed to come and talk to the media by himself. Okay. So actually, the movement of the venue from Kotu Central Medical Store to Banjul somehow signifies a big news to the public, but at the moment we are not sure exactly what is the reason behind the transfer of venue. But what we know so far is the Minister of Health, Dr. Amadou Lamin Samade, is supposed to speak to the press today.
All right. As you're trying to explain the reasons or the rationale behind moving the venue of the press to Banjul, now, what are the major issues expected from the ministry today?
We know since the beginning of the coronavirus or the outbreak of it in the Gambia, all positive cases have been announced by the minister himself, with the exception of yesterday when the Director of Health Promotion was allowed to announce the third case in the Gambia. Both the first and second cases were announced by the minister himself. So yesterday, there was some point in time that the minister was expected up to a certain time that the Director of Health took up to the media. But that also was a positive case. So as of now, whenever the minister is mentioned, it looks like that there is a new case. Already, on the social media, unconfirmed reports reaching out iAfrica is that there is another positive case, which is connected to the Bangladeshi who died on Sunday. We cannot independently verify this, but the fact that the minister is supposed to speak to the press today, we definitely think that this is one of the questions we expect him to answer, to authenticate or to dispel the announcement on social media.
Well, very well. Of course, we always want to give accurate and confirmed reports with regards to the situation of the coronavirus in the country. Now, as we await for the minister to come and brief the media on the level of the situation in the country, yesterday the director assured the media that the time was gonna be respected by 12 o'clock midday, and it looks like we have gone beyond that. Do you know why again the delay?
The promise of respect to time by the Directorate of Health Promotion and Education is nothing to go by, because even before we left the Central Medical Store, there was no prior information to the media that the usual ground for daily press conference would have changed. In fact, iAfrica went on to set up on the old building where the usual press conferences have been taking place already, then only to be told that no, it has to be in Banjul. That was already by midday. So traveling from that location to Banjul itself means it's past 12 o'clock. Now it is, more, the time has gone, and the likelihood of us staying to 5 o'clock or 6 o'clock is very likely. It's very high because right now there is no indication of the minister, although we came along with one of the government press officers or media officers, Prince Abubakar Sankano, who was helping us to locate the place, exactly the place for setup. But he is here alone and couldn't tell as to what the minister or when the minister is going to come back. We also understand the director of health himself, who we left at the central medical store, is yet to be here too. So for them to promise that press conference will be taking place on time, this is still a challenge on the ministry. But what we do as media, as far as we follow the news for our public and the viewers, followers, we have no option other than to follow the timing that they will deliver the press conference.
Well, of course, like you said, the challenge continues. I thought yesterday after that promise, of course, everything was going to work as he promised. But unfortunately, we again find ourselves in this situation. But the need for the people to be informed, of course, would always compel us to wait and make sure people are informed. Now, of course, you were talking about the indications that, it is not showing anytime soon the press conference is going to start. Now, of course, I was going to also ask on how does the situation and movement of people look like at the ministry where you are, knowing that we are talking about distancing of people and all that, where you are. Describe the situation for us, please.
Yeah, the announcement of the third case of coronavirus in the Gambia yesterday actually sent a bigger signal to the public. So since then, after knowing that the confirmed case or the patient came along with 59 others on the plane who are yet to be traced. So the public concern is now, what is the tracing methodology or what effort is being made? How far has the ministry gone? How far has health workers gone to identify the people he shared plane with? Is a concern. So who knows? Every home could be a host to one of those people who travel along with the corona positive patient. So this is a concern. And then upon arrival at the Ministry of Health here, we noticed that today the social distancing is noticeable. Some people are putting on these face masks. Others has gone to the extent of putting on gloves. So precautionary measures are noticeable from different people. So I think it is it's safer for the media today than ever before. So because I think the public is listening now.
All right, you continue to be safe with the entire team down there. Just finally, before we let you off and go, of course, and look forward to meeting the minister on today's information. Now, of course, we wouldn't want to rely or report on rumor like you said earlier on. But if should, of course, the minister come on and confirm another case today, then what should we predict for the future? Does this mean Gambia perhaps should expect now more cases, as it looks like the trend remains the same? We are having new cases almost every day, and it's a big concern, it looks like.
Should there be a new case today, that will be continuation of efforts now. As you know, the announcement by the president that suspended all public gathering was a concern. And yesterday, time and over again, the Ministry of Health has called on the public to adhere to these precautionary measures. So yesterday night on the national state broadcaster, actually GRTS, the Supreme Islamic Council president, announced call on imams to consider closing a mosque for the meantime, as it is in line with the teaching of Islam. So that gave also away that because the Bangladeshi national who was confirmed positive after he died in the Gambia on Sunday, it became a concern by the Ministry of Health as to the need to close the mosque, because he was reportedly to have prayed in one of the mosques since he was an Islamic preacher. So now, I mean, it will be a continuation. So it's up to the ministry now to catalog the areas that need to be shut down. Already as of yesterday, we understand the police also, managed to close certain, bars in town
Okay.
where they felt people are coming there to come, including the one at Westfield. Jacaranda was suspended as of yesterday. A week before that, the police also issued a release to say that all nightclubs and bars has to shut down. They have to shut down without delay.
Well, Ibrahim, listen, as we look forward to the minister meeting you and other press men and women on the ground, we have to thank you so much for your, of course, update. And we hope that, the minister would meet you soon. Thank you very much for your time.
Yeah, thank you very much. It's my pleasure to be with you.
Thank you. Thank you very much. That's our man, Ibrahim Pressba, on the ground, monitoring situation as we wait for the minister or the Ministry of Health to, of course, update the Gambians, of course, on the situation and the level of preparedness of government to counter the spread of the disease or COVID-19 in the Gambia. So, of course, we just want to remind you so far, based on our facts, and of course, as you may know, we have been saying this since yesterday, Gambia have 3 confirmed cases as at this point. Of course, there are speculation and rumors, whatever, but you will hear from the minister later on. I hope pretty much soon, live on Africa TV. But for now, we want to thank you again for always being with us, and of course, for relying on Africa for updates, and of course, as always, there's in other development with regards to coronavirus or other development in the country. Thank you very much for now. Till we meet again soon. Bye-bye.
man kontaan boy mu ne boy nga nyimbata mu be taki tubabu du boy boy nga nakko do mu be do ku boy nga kina nyin kendi moy boy pour ay bungulo nyi boro na bungo hani lento am futa je boy de jibe lu njumala ya funya koy babun lola ama me ila bungo jibe abadame
jara foyte lafta fula nyi man balwo kanam
mu balwo fo balwo ko budlo ko fanan kele boy
nyim bungo jala be nyamente abe mu balwo la do ko
ñin kunne suniata ta www.baluwo.com anin baluwo isela bulloran jorangol be sang anila kudula asatare mambata jorangol membu ko cemento kenyo babaro nil peruol woni nga nyon jamal ta baluwo.com yin jorangol be sang ila dinkira bado adungite batala je anin baluwo ifangole marate la kudula.
Hey there! You must have heard about a disease called COVID-19, or most popularly, coronavirus.